My name is Heather Hurst and I'm a Quality Improvement Lead for Birmingham and Solihull Mental Health Trust. Today I want to quickly take you through how to complete a project charter. So over the next few minutes, we're going to have a little look at what a charter is and why we use it, and then we'll have a look at how you complete some of the sections of a project charter. So what is a project charter? A QI project charter is simply a project on a page. This outlines the rationale for the project and some of your initial thoughts on how you're going to get there. It really just takes you through the why and the how of your project, which forms the starting point for the model for improvement. Within Birmingham and Solihull Mental Health Trust, the QI project registration form acts as your project charter. So when you register your project, you will be completing this. So why complete a project charter? It's really tempting to dive straight into project work. We often have ideas about the things that we want to discuss, or we have change ideas that we're just dying to try out. However, there are 3 very good reasons to step back and spend a little bit of time in this planning phase. And these benefits are on a personal level for the team and for the organisation. So on a personal level, the charter helps to clarify your thinking. We regularly speak to project leads who have a kind of vague idea of the what, and the charter is an aid to considering all of the other elements that you may not have yet thought about. So if you can fill out a project charter, then you are well on your way to having a QI project which is ready to start. If you can't fill out the charter, this is fine also. Just get in contact with the QI team and we will be more than happy to help to refine some of your ideas. On a team level, every QI project is a team effort. If there's only one person involved, it isn't a QI project. The charter communicates a shared vision. It's a key communication tool to help inform the project team, your colleagues and sponsor about the plan and your intention. It will of course evolve as the project progresses and the charter will be updated to become a live record, and this is fine. Within Birmingham and Solihull Mental Health Trust, the charter is the starting point for your project page on the live QI portal, and this will gradually build to collate all of your learning and your progress. And then for the organisation, the charter allows us to understand all of the improvement work happening in an area. It links projects up where possible and prevents competing work. The QI team is on hand to offer advice and support as long as we know about your project. We could also intervene early if your project would be better suited towards audit research or one of the other improvement methodologies, thus saving you wasted time and effort. So let's get into the detail of what you need to put into your charter. So first of all, we need to know who's involved in your project. One of the key roles within a QI project is the sponsor. The project lead is responsible for the project outcome, but the project sponsor is responsible for project progress. They may not be involved day to day in your project, but they will be the person that you will call in when you meet barriers, and they will help you remove them and keep the project moving. The project sponsor needs to be someone with enough seniority to be able to wield this kind of influence. So please ensure you have conversations with your sponsor about how you will be regularly feeding back to them, about how you are progressing, and how you will escalate when you need their intervention. This is more than just a nominal role, so worth establishing this from the beginning. We also need to know who is in your project group. So you need to gather people who are subject matter experts on the topic you are working on. So this will typically be the staff who work within the system you are improving. So for example, if you're working on a project looking at reducing the amount of people who don't attend for their appointment, DNAs, you might need the involvement of admin staff, nursing, medical staff and service users and carers to reflect the many people within the appointment system. We would recommend between 3 to 7 people working together on a QI project. Of course, there will be others who are supporting the work, but you just need to list the core group who will be driving the project forward. The team should be multidisciplinary and each voice is as important as any other. Whilst all staff should be kept up to date with project progress, the core team will be those staff who are attending meetings and taking forward the change ideas, and this is who we want to know about. We also need to know about service user involvement. So evaluations have shown that QI projects who actively involve service users and carers in a collaborative and meaningful way are more likely to succeed. Certainly in my experience, they always bring a unique and valuable perspective that we wouldn't have considered had it not been for their involvement. So this needs to be planned from the start of the project. And we have some experts by experience who've been trained in QI ready and willing to support you. Just contact us if you need support. On the charter, we ask you to state your intention in this respect. So this could be an expert by experience involvement using a little I. And what this means is that you will bring in the voice of the service user at various points throughout the life of the project. So you could use surveys to gather their opinions, forums, you may ask for ideas about change ideas and for their feedback on these services that they have received. Big I means involving service users and carers directly and continuously throughout the whole life of the QI project. So you will have someone in your project meetings from the very beginning, playing as important a role as every other person in that core group. The next set of questions describes the main body of your intended QI piece of work. They're the starting point for how you answer the questions within the model for improvement. This will change as the project progresses, but this initial information helps us ascertain if this is indeed a QI project or if there are any areas where you may need a little bit of additional advice, which we are more than happy to give. So we will ask you to describe the topic or issue that you would like to improve. This is an overview of the issue or problem and the situation within your team. For example, the issue could be that waiting times are too long, or it could be that the current process for something is problematic and leading to staff dissatisfaction. It just needs to be 2 or 3 sentences that are descriptive in nature and outline the current situation. We will also ask you for an aim statement, and this is a preliminary aim statement. This is the 1 or 2 sentence statement about the aim of your project. It's a description of the outcome and should include the what, the for whom, by when and by how much. This is a good example of an aim statement which incorporates all of these elements. So the aim statement here is reduce the waiting time for the first outpatient appointment within the community mental health team by January 2023, from an average of 8 weeks to an average of 4 weeks. Of course, this will evolve as your project group starts to nail down the direction of the project, and this is fine, of course. But we're looking for an initial description of how the world will be better once your project is complete within this statement. We will also ask you to describe why this is an important issue to tackle. Why does it matter? So within this section, we want to know why it matters. The previous question focused on a description of the current situation and the intended future state. This is where you describe the impact on staff and service users. So if you do nothing, what will be the potential harm caused? Where there's actual harm or how someone is affected, then describe that. Also, what will be the benefit of tackling the issue? So if I use the previous example of reducing waiting times, I may want to talk about the harm that can occur when the start of treatment is delayed and the stress and anxiety that this can create for both service users and families. I could also describe how reducing the time to assessment and the start of treatment would facilitate earlier intervention, which would improve treatment outcomes and satisfaction. So this is where you can include a real-life example that may have prompted the project or any data that you may already have. So how will you know that a change is an improvement? The next set of questions really starts to define how you'll measure the impact of your changes. It takes a lot of effort and resources to start working in a different way, And all too often we bring in a change without actually evaluating if we've achieved our original intention. By measuring the impact of our changes, we can tell if the idea has been a good one and actually objectively made a difference. Or if it hasn't made the impact we wanted, then we will need to think about how we adapt it or abandon it. So we ask for a preliminary data collection plan, as you should already be planning what data you will need and how you will collect it. You should be starting to collect your baseline data and taking steps to plan any manual data collection or contacting data analysts if it's available automatically. To reach this stage, you do need quite a detailed idea about the things like the frequency of your data, and this is what we want you to put on the form to tell us about. So what changes can you make which will lead to the improvement? So one of the criteria for a QA project is that it isn't a simple problem that can be addressed with one solution. Rather, it's complex and knotty, and the aim is to introduce a range of iterative changes that, when taken together, bring about an improvement to the whole. All too often, project groups have one single solution which they may want to implement, and this is fine. Of course, you can go ahead and do that work, but it's not a QA project. So in this section, we need to know that the project group is planning to test several different change ideas to understand which are the most effective changes. This section needs to include your preliminary change ideas. Of course, the nature of PDSAs means that these ideas will change and evolve, and this is fine. However, you need to have a starting point, and this is the place to describe some of those initial hunches which you're planning to explore. And that's it. Hopefully you will now have a good understanding of the things you need to be considering as you're planning your project. This is a crucial stage in any project because you need to go slow to go fast. So what this means is this planning project will really set you up so well in your project work that it is really important. Of course, if you need any advice or support, please do get in contact with the QI team. We are always happy to help. And please do look at our resource page on Connect, where you'll find a range of additional resources that you will hopefully find useful. I want to wish you all the very best of luck with your QI project.